Hi Shakaya. We're going to go through an adult pre-exercise screening tool. The purpose of this is I'm going to ask you a series of questions to try and figure out as much medical information as I can. You don't have to answer any of the questions if you don't feel comfortable. However, by not answering, I won't be able to obtain an accurate risk stratification. Therefore, I won't be able to prescribe you an exercise program. Okay? So just keep that in mind when you're answering the questions.
No worries.
So the reason that we are doing this is we're trying to find out if you have any contraindications to exercise. So by contraindication, I mean any pre-medical condition or injury that you've had in the past that will prohibit you from doing an exercise. So it can be something as simple as a sore knee to something as complex as a cardiovascular disease. Okay? So I'll be asking you these questions in stage 1, and then we can go to stage 2. By identifying these contraindications, it helps me determine the appropriate intensity of your workout that I can set for you, as well as what exercises to put in your program.
Yeah, okay.
Okay? An important reason that we do this pre-exercise tool is to also, it's very important, I need to identify if you do need medical clearance before I write you an exercise program.
Right, okay.
Okay, so are you happy for me to go ahead?
Absolutely.
Awesome. Okay, stage 1. Usually stage 1 you can do by yourself, but as I'm here, I might as well just go through it with you.
Okay.
So, 1. Has your doctor ever told you that you have a heart condition? Nope. 2. Do you ever experience unexplained pains in your chest at rest or during physical activity?
Mm-hmm.
Do you ever feel faint or have dizzy spells during physical activity that cause you to lose balance?
No.
If you have diabetes, type 1 or 2, have you ever had trouble controlling your blood glucose in the last 3 months?
Don't have diabetes.
No then. Do you have any diagnosed muscle, bone or joint problems that have been told, that you have been told that could be made worse by participating in physical activity?
No.
Okay. So that's excellent. Because you have answered no to all these questions, I don't need to refer you to a medical healthcare professional. Therefore, we'll just go straight to stage 2.
No worries.
Just sign there for me. Awesome. Okay. You're a female.
I am. Thank you.
And you, how old are you?
22.
You're 22. Okay. Do you have a family history of heart disease?
No.
No. Do you smoke? Good. It's a bad habit. Describe your current physical activity or exercise levels. So, greater or less than 150 minutes per week.
Does horse riding count?
If it gets your heart rate up.
Yeah. I would probably spend about 150 minutes a week. doing horse riding.
Ready? Okay, that's good. So question 5 asks you your BMI, which we will work out after I do this.
Okay.
Have you ever been told that you have high blood pressure?
No.
No. Have you ever been told you have high cholesterol?
No.
No. Have you ever been told you have high blood sugar? No. Cool. So on this page, your risk factor is still 0. Cool. So that's good. That puts you in a low category.
Awesome.
9. Have you ever spent time in hospital, including day admission, for any medical conditions, illness, injury during the last 12 months?
No.
Are you currently taking any prescribed medication for any medical conditions?
No.
Are you pregnant or have you given birth within the last 12 months?
Bloody hope not. No.
That's a no? Okay. Do you have any muscle, bone or joint or soreness that can be made worse by participating in physical activity?
Nope.
Okay. We now need to assess your risk stratification. Okay. So, by your answers in our exercise pre-screening tool, I can stick you under the low risk category, as you didn't say yes to any of the questions. I didn't need to refer you to a medical doctor, and you didn't get any pluses or minuses for that one. So you are a low risk client. Therefore, because you are at low risk, you can participate in vigorous intensity. So that means I can get you in the program when you do cardio or anything. Your heart rate can be at 90% or more.
Oh, okay.
And so your rate of perceived exercise can be greater than 7.
Oh, okay.
So that's excellent. You don't need to be referred to a medical clearance. Therefore, you can undertake an exercise program today.
Sweet.
Thank you.
Cool. Thanks.